most common illnesses that we usually see during the winter months, over and above people falling down and injuring themselves on ice, are usually cold and flu-like symptoms. Most of these are upper respiratory infections. They are cough, runny nose, aches, fevers, some headaches. And these infections, they cover a broad range of potential infections from viral to bacterial. The difference between viral and bacterial infections are sometimes very difficult to tell just based on clinical scenario alone. The majority of infections are viral, and they're caused by viruses, microscopic particles, and really there's not treatment for them in just a quick pill or a shot the way a bacterial infection could be. The most common bacterial infection that we see during the winter months is usually strep A. It's commonly referred to as strep throat, and it's usually associated with pain on swallowing, very swollen tonsils, and a purulent exudate or whitish stuff coming off the tonsils. That is usually still self-limited, but many people do feel that they feel better if they take some antibiotics. The reality of it is, with strep throat, antibiotics usually will only go ahead and decrease the incidence of the symptoms by about a day or so. The time course for the viral illnesses that cause these upper respiratory infections usually start in late August, early September, and work their way through until March or April. So most of these symptoms actually come on in the November-December time range, also when it's colder, when people are in close quarters, so they pass these germs on from one person to another. And then usually by the spring, not only have people built up resistance to many of these bugs, but they also are getting out more and opening up the doors and windows, and they're not in close quarters. Usually patients who come in with these cold or flu symptoms, they have actually been exposed to the illness about somewhere between 3 and 5 days prior to actually onset of symptoms. In adults, a lot of these symptoms will then last from anywhere from about 1 to 2 weeks and then start to get better. In children, the symptoms usually last for about a week and get better. The viruses and bacteria are passed from one person to another. It can be direct if somebody sneezes on you, and direct transmission of droplets from one person's respiratory tract to another. But there's also the indirect transmission, so I sneeze into my hand and then I go ahead and I open the door, then you go and close the door and rub your face, and then there's a transmission of these bacterial and viral particles to you as well.